we either have or get a semen analysis, and usually repeat the semen analysis. And we want to do that so that we are optimizing the male so that his semen parameters are in the highest range. Unfortunately, many women will experience potentially a miscarriage. It's quite common. I've heard a couple of statistics quoted, 1 in 3 and 1 in 4 women will experience a miscarriage. And having gone through it myself, it's a really emotionally difficult experience, at least it was for me. And my heart goes out to anyone that is struggling a pregnancy, whether it's currently or in the past. So I'm with you, and good vibes for healing, and just know that you can get through this. It'll get easier. It never completely goes away. At least the sadness hasn't gone away completely for me, but it'll definitely get a lot easier. And recurrent miscarriages, we don't know, unfortunately, a lot of times the cause. Many of the earlier pregnancy losses are thought to be genetic, and genetic testing can be done on tissues from pregnancy loss to determine if there was a chromosomal abnormality at least. And there can be other reasons. There can be a coagulation, so blood clotting problems in the woman, and that can lead to a pregnancy loss. And sometimes we see those early losses that can be contributed to the coagulation problems, and also it could be a little bit later in the second trimester as well. We're looking more into the male factor piece of potential contribution to pregnancy loss. And DNA fragmentation is a way of looking at sperm that is different from the strict Kruger semen analysis that's done more commonly. The DNA fragmentation looks at the DNA of the sperm, and we'll dive in deeper to see what quality is that sperm's DNA. And it's found that lower quality DNA in a sperm does relate to a higher miscarriage rate in that couple. So we are looking research-wise at that piece, and that's why it's so important to look into the male's health as well as the female, because we want good healthy sperm so that we make a good healthy embryo and to have a successful pregnancy and a healthy baby. We look at very often pretty much every male that comes into our clinic, we either have or get a semen analysis, and usually repeat the semen analysis. And we want to do that so that we are optimizing the male so that his semen parameters are in the highest range for healthy natural conception. For patients that have recurrent pregnancy loss, I think it's very important to seek out a holistic fertility provider, and then we can dive deep into why. Why are you having these pregnancy losses? And we might not know exactly why. We might not come to one root cause of the problem, but we will most likely uncover many things that can be worked on and optimized so that once we optimize the female, her hormones look good, her lab work looks good, her nutrient level looks good, her cortisol curve and her stress levels during the day and her sleeping at night, all that looks good. And then we simultaneously look at the man, and his semen parameters look good, his lab work looks good, his cortisol curve and stress levels, his sleep. Then at that point, what we call give the green light to, hey, let's go get pregnant, because that is most likely going to result, once things are optimized like that, in a healthy pregnancy. And our pregnancy loss is almost non-existent, very close to it. So we love that and pride ourselves in that, and that's why we know, hey, we need to optimize both partners before going for conception again, to help prevent the pregnancy loss, the heartache, the having to move back in time, so to speak. Not really back in time, but we have to allow more time to get the hormones, the woman optimize her hormones back to the normal level, her emotional state back to a healthy state. And pregnancy loss does, in a way, keep us from moving forward more quickly. So that's why we recommend during this time of working to optimize the male and the female that the couple is not trying to get pregnant at that time. And especially we do detoxes as well. So we want to make sure we get all the toxins or many toxins out of the body as possible, and that we have enough time for the egg and the sperm turnover to be in a more toxin-free environment.
If you'd like to learn more, please like and subscribe to my channel.